Well, COVID is still with us this cold and flu season. Another viral illness is filling up pediatric beds as well. Maryland, among several states, reporting a rise in RSV cases, and pediatricians want parents to know how to best protect their children. Joining us now is Dr. Shanti Woods. He's from Mercy Medical Center. Thanks so much for your time, sir. Good to see you.
Hey, Jason, good to see you. Thank you for having us.
Yeah, let's talk a little bit about RSV. For some folks, that initial means nothing to them. So enlighten us. Tell us what's it all about. And it seems like infants are affected the most.
That's right. So RSV, or respiratory syncytial virus, it is a very important virus in the pediatrics world, also can affect the elderly as well. But essentially, it is just like I think of the flu almost, in that it could give you really high fever, make you feel very lousy and miserable as a baby. Often it is accompanied by a lot of congestion, coughing, and it almost can resemble, Jason, an asthma attack in toddlers. So we're talking about kids 3 and under. And it typically likes to pick on the premature. So if you were born before your due date, anytime 3 weeks or prior before your due date, we call that prematurity. And usually it's the very premature. So I was born at 31 weeks, 32 weeks. It usually likes to pick on that population.
Just how serious of an illness is this?
It could get quite serious, in that it involves the lungs. The lungs, it's an organ, but we like to think of it as it's muscles controlling the lungs. In kids, you breathe fast, the body can compensate for that. However, once you've been breathing fast for hours and hours and hours, those lungs, or the muscles controlling the lungs, they could get tired, and it can cause something called respiratory distress and or respiratory failure. What does that mean? Often children are seen in the ER, and the most sick of children have to be admitted, often to the ICU, and sometimes kids have to be intubated, which means have a tube go to their throat to help them breathe and take over the breathing for them.
And tell me about, as we were talking about kids in school and heading back to school, because some have spent, years at home at some point. Some, I guess the youngest of them have spent, a year at home learning, and then finally it's their first introduction, which means it might be their first introduction to getting ill. Have you seen many parents bumping into that at the beginning of the school year?
We have, actually. So children, you're right, they're returning to school, they're mixing and mingling with their friends as they should. But what does that mean? That means that their immune system is saying, hey, what's going on? We've been on chill mode for the past 2 years, 2.5 years. So to see this robust requirement of the immune system in addressing some of these illnesses, these viruses, it's gotten a lot of kids into some quote unquote trouble, meaning that they're just having symptoms. Often it's mild symptoms, congestion, cough, runny nose. But for some children, if they have a background of asthma or seasonal allergies, they could get, a little sicker, again, requiring a visit to their pediatrician, urgent care, or an ER.
Let's talk about shots. We'll start with the flu shot right now, because I think everyone is pushing those. Should most kids get them? Should all kids get a flu shot?
So, I am a fellow of the American Academy of Pediatrics, and that simply means that we are in full support of vaccines, and we want to prevent illness. That's what our job is, preventing illnesses. So yes, I'm a strong proponent of vaccines. We've seen vaccines save lives. We've seen vaccines prevent kids from getting sick. So yes, we are a proponent of vaccines. There are some vaccines that are required for you to attend school. There's been some confusion about COVID and if it is a requirement to go to school or not. It's a recommendation, but not a requirement.
And on that trend, I guess I can guess what the answer is as you explain your feelings about flu shot. Let's talk about the bivalent shot. We saw the president get his, so I think he's up to 4, like many people are. Should kids and their parents be thinking about the same thing? Should they be on the same pace and schedule as an adult?
So yes, the bivalent shot, which is going to be the shot that's helping protect against the Omicron variant of coronavirus, it is now recommended for children 5 years old and above. Again, that's 5 and above, you're eligible to receive the bivalent shot. Well, why is that a good thing? Well, each year the flu shot changes, and sometimes it's just by a little bit, but it changes because the variant of the flu that's going to be out for that season changes. And COVID is no different. It does what I call a remix. And so, the 2020 COVID is different than now the 2022, soon to be 23 COVID. It changes, it's done a remix. And so we on the medical side have to keep up with those remixes. And so the bivalent shot is going to be the one that's helping protect against the Omicron variant. And then if you are a parent of a child who's 5 and older, you should strongly consider your child getting that bivalent shot.
All right, that's Dr. Shanti Woods from Mercy Medical Center. Thank you for the time this morning.
Thank you so much, Jason.
Yep, take care.